I am Grudy Cullen in the CapeCod.com News Center, and I'm joined today by a special guest, Eliza Dushku. You might be familiar with her from her roles in Buffy the Vampire Slayer, True Lies, and in Dollhouse. Thank you so much for joining me for this conversation today. We wanted to talk a little bit more about your advocacy. We have a ballot question, question number 4, that kind of digs into some alternate forms of treatment involving psychedelics. But do you mind telling our listeners a little bit more about your advocacy side of things before we get rolling into the rest?
Sure, yeah. Hello, I'm Eliza Dushku Palandjian. I guess the only correction I would make is that I am not an actress anymore, and I'm currently a clinical mental health counselor in training, and I am, studying to be a mental health care provider. I have come to being so passionate about psychedelic assisted therapy, both as a behavioral healthcare provider and student, and also as a client and or patient. I was very I was public about my personal story in this past month's Boston Magazine. I was really nervous to do so, but I felt it was my responsibility, especially given the time right now, and especially given this important ballot question 4. Psychedelic assisted therapy really changed my life. I'd say it saved my life, not to be dramatic, but that's the reality. And I am really passionate about seeing it help others. And so, yeah, voting yes on 4 this election is so important because even if we say yes to this today, there will be a 2-year rulemaking process before this becomes available in regulated therapeutic ways for veterans, for anyone in Massachusetts who would benefit from this treatment. If it does not pass this election, it'll be about another 6 years. And the reality is, we know, I think the public knows, this is a breakthrough. This is a breakthrough, effective treatment. And we're in a mental health crisis, and people are suffering, and people are dying, and we need this option. We need this new tool now.
Mhm. Now, just a quick outline for people as well. The ballot question, it is a proposed law that would allow persons aged 21 older to grow, possess, and use certain natural psychedelic substances. We'll have the official chemical names in the ballot question in the description below for people who want to dig in more. But yeah, it's been involved in various therapies. Do you mind? Do you think also approval of this would kind of maybe break down some of the stigma that might surround alternative forms of therapy? And maybe is it important for improving conversation surrounding trauma, PTSD, things like that in general for you?
Absolutely. I do think that as a society, we're doing a great job at naming the mental health crisis that we're in. I think there's been a lot of great advocacy, and we know what it is now, and there's less shame and stigma around it. And we don't have a lot of good options to treat it. The psychiatric community knows that, the medical community knows that. It's we are in need of new tools, and we are in need of new options to combat the crisis. There's absolutely still remaining stigma around psychedelics. So I think a lot of people think back to the 70s and sort of horror stories they may have heard about somebody on a psychedelic hallucinogen. But where I think the education is so important, and why I'm out here honestly doing this work, is I had a new education starting 6 or 7 years ago with my personal experience. And this is being studied at every single major medical organization in the state, in our country, if not the world, when it comes to mental health. Mass General Hospital, one of the best in the world, and the Brigham Hospital, Brigham and Women's, they have Center for Neuroscience of Psychedelics set up. There are clinical trials. We're working with the Brigham on clinical trials that focus specifically on psychedelics and addiction. I think a lot of people are not aware that psychedelics can be very effective for those suffering with addiction, because so much addiction is trauma informed. I believe my addiction was trauma informed, but if you can treat that underlying trauma, it's actually very helpful for those suffering with addiction. So, yeah, the education piece is huge, and the destigmatization. And if I may, one other thing you spoke about, this is a two-part bill. This is about allowing for regulated therapeutic access to psychedelic therapy with therapists, trained facilitators. And this is about decriminalizing personal use and allowing for some personal home growth. I think that the opposition, respectfully, has taken that into the land of fear mongering to a degree, because the reality is people are using psychedelics. society and our culture, we're aware that these are breakthrough medicines for treating mental health. So people are using them. And what the problem is that people are buying them illegally and buying them in the black market where they are exposed to, tainted product with neurotoxins and all these scary things. And so you can't decriminalize this without allowing for a homegrown element, because otherwise you're sending people right to the black market to procure their medicine. The American Medical Association, frankly, agrees on this. They went on the record this year and said that they are for decriminalization of psychedelics. They've been decriminalized for the last 2 to 3 years in Cambridge, Somerville, Salem, Northampton, I think 8 cities overall, and there's been no uptick in, people driving under the influence or emergency room visits. There's so much fear mongering around this, and that's part of why I'm being so vocal about it. Is that it's just sort of setting the record straight about what it is and what it isn't.
Hmm. Now, as what you are a professional in the space and have, judging by 7 years, you were seeing right through the COVID pandemic, unfortunately, and that seems to have completely skyrocketed. Or I don't want to say that it certainly did have an impact on mental health, but it also revealed a lot of issues that simply were already there. Do you mind sharing maybe some of the anecdotes or just like your experiences now studying? Do you see some of the effects on other people where it's like maybe they weren't even familiar that this was an option, and like now once they're exposed to it, they realize that how could this not have been available sooner for them? Like, are there some success stories that you can share outside of your own as well?
Absolutely. For one, I would say, I'm working right now with the military veteran population. I'm working at Mass General Brigham's leading organization for military veterans and service members and their families. And when I did my psychedelic assisted therapy training at the California Institute of Clinical Studies, which is the first accredited university in the country to do a certificate training program for this, where they teach you very specific protocols on how to work with patients and clients in this space. We spent a lot of time watching video and studying these trials being done on veterans and on folks with intense trauma, intense PTSD, and complex trauma. And that was where I first witnessed the transformational power of these medicines. I mean, you see people who had been to every shop on the block. They've spent 10, 15, 20 years just suffering with these treatment resistant traumas, depressions, anxieties, and they do 1 to 3 sessions of psychedelic assisted therapy and they have a completely new life. Again, this is like not saying that this works for everybody. Certainly there are those who this does not work for. There are some people who have adverse reactions, as there are with any medical intervention that exists, right? But the benefits absolutely outweigh the risks when we have a population, in the veteran population, I believe on the low end, 20 to 25 veterans in our country commit suicide per day. And to me, that's just devastating, and it's unacceptable that we know there is a treatment that could serve this population, and we are not making it an option and not making it available for them. So yes, I've witnessed people having tremendous healing in doing this work, and I want to see that available for more people. Pardon me, I think I need to go to my next meeting for work in a moment. But as far as other examples, I think, let's see. There are really so many. There are so many applications. I think you mentioned the pandemic, and you know, even in my university, we're aware that they're trying to allow for more graduate students to start getting out into the field to start working with patients, because no one can find a therapist these days. There is so much need and there is so little supply when it comes to therapists. And when you look at the disconnection, really, that the pandemic, we know, exacerbated. We were already a society that's becoming less and less connected, given media, tech, and such. But to me, I also have always looked at addiction as a disease of disconnection. When we are disconnected, we are suffering, and we need help. And everybody knows that psychedelic assisted therapy is an extraordinary connector. It reconnects people to themselves. It reconnects people to their families, to their communities. I think now more than ever, there is such need and such application for this treatment.
Mhm. All right. Well, thank you very much for talking more about your advocacy. And yes, on question four, is there anything else you wanted to highlight for our listeners while I still have you?
No, just that it's wonderful to, be here in Massachusetts and have the opportunity to advocate for this work. And I hope people, vote with their hearts and they keep in mind that this is about hope and healing on the ballot this election. And yeah, this is going to be something that is regulated and it's we're going to get this right. If this passes, it goes to the legislature for about 2 years, and they can improve parts of the bill. They can they can take pieces out. They can adjust the size of the personal growth use space. I know that's been kind of on some people's minds, is that too big of a space? That actually came from the Colorado ballot, which a 12 by 12 room was deemed the size of an average room in America. But some people in Massachusetts think that that's too big. This will go to the legislature, and I trust that the legislature will get this right. They can minimize it, they can improve it, but let's not kill it. We need this, so let's trust in our attorney general and our governor that we're going to get this right. We have the best medical minds in the world right here in Massachusetts. We're going to get this right, so let's have some faith.
All right. Awesome. Thank you so much for joining me for this
Thank you.
conversation. It's been a pleasure.
Cheers.